Cases of coronavirus variants believed to be more contagious have been identified in just about every U.S. state. Now, a top U.S. health official says there are two ways to combat those variants. Mandy Gaither has more in today's Health Minute.
In the war on COVID-19, there are still plenty of questions, including how long vaccines last and do they work against the highly contagious coronavirus variants.
While we are starting to see emerging evidence that the vaccines remain effective against circulating variants and that the risk of breakthrough infections in vaccinated persons and spreading the virus to others is low, we must be resolute in our efforts to fully answer these critical questions.
All three companies with vaccines now authorized in the U.S. are working to make sure their product provides protection against the variants. This week, Moderna announced the first participants have received its modified COVID-19 vaccines designed as potential boosters. In the battle against the variants, two strategies are now being pursued in the U.S. Vaccinated people could get specific booster shots against each variant that crops up, or get a shot that offers protection against several variants.
Here is the challenge. Are we going to chase each variant in an almost whack-a-mole way, or are we going to try and get a vaccine that has a good degree of cross protection against several and get the level of virus so low that we don't really have an outbreak proportion?
And all that hinges on more Americans getting their COVID-19 vaccines.
We ask for your participation by rolling up your sleeve when it is your turn to be vaccinated, and we ask for your leadership in helping others do both of the same.
For Health Minute, I'm Mandy Gaither.